Good afternoon. 2025 was a busy year for the Tennessee General Assembly.
Well, state lawmakers introduced close to 3,000 bills, and they don't show plans of stopping that momentum. Madison Sims joins us with what to expect on the docket for this year. Madison.
Latrice, rural health care accessibility and school choice vouchers. These are just a couple of the items the Tennessee General Assembly will be addressing at their first meeting next week. But until then, here's a closer look at several of the top bills state lawmakers are eyeing in the new year. The Tennessee General Assembly is getting ready to meet again for the first time in the new year on January 13th. So we're taking a look at some of the top bills being introduced in the new year. January 1st, the state launched the nation's first registry to identify repeat domestic violence offenders. It was created under Savannah's Law, named after Savannah Puckett, who was a Tennessee sheriff's deputy murdered by her ex-boyfriend in 2022. The registry is managed by the Tennessee Bureau of Investigation and includes the offender's name, photo, date of birth, as well as the date and county of conviction. Since it launched, 11,000 people have visited the site. We're also following the possible expansion of Governor Bill Lee's private school voucher program that became law in February of 2025. The Education Freedom Scholarship Act funded 20,000 scholarships for children across the state. This year, Governor Lee and Speaker of the House Cameron Sexton want to increase that number.
I would like to meet the need from last year, so I would say minimum 42,000, but we'll see what happens.
But with current funding levels, that could cost the state another $144 million. Another bill to watch is a proposal that would make it a Class A felony to knowingly train AI to encourage suicide or homicide. The legislation would also ban using AI to impersonate a human to form emotional relationships with harmful intent. Also coming to this legislative session are improvements to rural health care. Tennessee is expecting around $100 million per year from the federal government for its Rural Health Transformation Program. A bill filed in the House and Senate requires the Commissioner of Health to create programs designed to make dental services more accessible for those in rural areas. We have a link to each of those bills inside this story in our app.